Welcome to Encouraging Wellness, where we shed light on the plethora of holistic healing and wellness methods so you can give yourself the power to ask why and become bigger than the condition you are dealing with or the illness you are currently fighting. Join Pamela Wirth as she sits down with doctors, medical experts, healthcare practitioners, and those with unique healing stories to dissect groundbreaking practices that combine traditional Western medicine with alternative modalities. Hear conversations that empower you to go beyond hurtful stigmas, outdated practices, and unnecessary labels, guiding you towards a healthier and happier you. Here, we highlight your true worth and help unleash your inner courage. Now your host, Pamela.
Hi, this is Pamela with the Encouraging Wellness Podcast, and today I have Dr. David Hanscom, spinal surgeon, orthopedic surgeon. Tell us a little bit about yourself.
Hi, Pam. Thank you for having me on the program. So I'm an orthopedic spine surgeon. I practiced complex spine surgery in Seattle for over 30 years. And so my practice was sort of the end-of-the-line practice. I was considered one of the salvage surgeons in town. There's maybe 5 of us. So I would get patients who are at the end of the line, multiple operations, some people 10, 20. My record is 29 operations over 20 years. And so once you have a failed spine surgery, it is just devastating. So I ended up looking back at the original films, and a high percent of patients never needed surgery in the first place. So they started off with an operation they did not need, and then their spine started to break down. And when you have 20, 15, 10 operations in your lifetime, it starts destroying your entire life. So I quit my practice in 2019 to actually show people how to heal chronic pain without surgery. And so we've had a lot of success with that.
So tell us a little bit about how you are doing this now. I believe you've got an educational series, you've got a book. So tell us a little bit about how are you helping people with this?
Well, just briefly, I spent 15 years in chronic pain myself, and I did not know what hit me. I went to multiple doctors. Nobody could tell me the answer. Like most patients in chronic pain, I lost hope. And what I didn't realize back then is that mental pain and chronic physical pain are the same entity. They're processed in the same part of the brain. So I developed 17 different physical and mental symptoms. And I didn't realize I went from a fearless spine surgery to crippling anxiety in a day. And once that lid came off the pot, I could not put it back in place. I ended up with crippling anxiety for 15 solid years, and I got lucky coming out of it. So the reason why, so I wrote a book in 2012 and the second edition in 2016 called Back in Control, A Surgeon's Roadmap Out of Chronic Pain. So it reflects my journey crawling out of this hole about a millimeter at a time. Then I started to work with patients and finding out what worked and didn't work. And then when I quit my practice, I wrote another book called Do You Really Need Spine Surgery? And spine surgery is not that hard to decide what to do. If you see a surgical problem, it can be solved by surgery. But there's so much surgery being done on normally aging spines, it can't help. I mean, you have a spine that's normal, how can you turn it into a massive scar tissue and bone and have it help? So I wrote the book called Do You Really Need Spine Surgery? And it's intended for patients to make better decisions, and also intended to make surgeons more accountable to their patients and to other providers. Because surgeons make these declarations about what should be done, and nobody can argue with them. So my goal is to create accountability with this book, and most people that read the book, some go through. So I'm not trying to stop surgery, I'm just trying to stop surgery on normally aging spines. So then what's happened, I have had hundreds and hundreds of patients get better with my first book, Back in Control, and my website, Back in Control. But what has evolved over the last 2 years is called the DOC Journey, which is a computer-based course that goes through a sequence of getting people to learn the principles, starting to learn tools to calm down the nervous system. And so it's a much more efficient, effective way of getting people to heal more quickly. So that's called the DOC Journey, Direct Your Own Care Journey. It's very self-directed. We do often layer on resources, but as opposed to jumping around trying different resources, it's more of a thoughtful, layered approach. All it does is reflect the deep medical science of how to treat chronic disease. So that's in place. We also have an app called the Doc Journey, also the Doc Journey app, which is based a little bit more on workshops is quite entertaining. My wife actually took the project over, said what I was doing wasn't an app, and she was right. But it's got the cup song, vision boarding, juggling scarves, all sorts of stuff. So when you're at play and relax, it changes your body's chemistry. So that's more the app approach, but both are effective, depends on what you connect to. And so then I'm just going all over the country, giving speeches, talking to people, doing public appearances, trying to get the world to say, look, medicine's hurting you. Stop. I'm trying to talk to medicine saying, quit hurting people. So yeah, I'm on a mission to do what I can do. I realize the problem's way bigger than I can. I have made lots of difference in individual people's lives, but I'm probably not going to change this juggernaut of medicine anytime soon.
Well, I mean, it's pretty exciting. The thought that you actually can control your own destiny with pain here. I mean, A, you're trying to help, by not doing unnecessary surgery, but B, there's obviously a lot of pain, opioid abuse. And so that's certainly a step in the right direction as well. So what are some of the types of pain that you've had success with your patients in? I mean, what kind of things are they experiencing?
So when people ask that question, what we forget about what is actually chronic pain.
Mm-hmm.
Okay, so any signal that comes into your body that's unpleasant should be considered pain. So too bright, too loud, too sharp, too dull, right? But what happens is that it turns out that every chronic disease, every one of them, has the same root origins with cell dysfunction, genetic dysfunction, inflammatory markers. And so what happens, you have the same response that causes every disease. So it turns out that anxiety, depression, OCD, bipolar, and schizophrenia are all inflammatory disorders, every one of them. Then you have Alzheimer's, Parkinson's, cardiovascular disease, peripheral vascular disease, obesity, hypertension, and diabetes are all inflammatory disorders. So is osteoporosis, and so is cancer. So what happens when you're under sustained, I call it threat physiology, which we'll talk about in a second, your body attacks itself. And so it turns out that at the very bottom of this cascade of dysfunction, there's a sequence that creates all these different chronic diseases. They're all the same thing. So let's talk about symptoms for a second. So obviously back pain, neck pain are all chronic pain syndromes. Pelvic pain, that type of thing is all inflammatory. But I had 17 symptoms at the same time. So I had ringing in my ears, or what's called tinnitus, migraine headaches, back pain, neck pain. I had burning sensations in my feet. I had obsessive compulsive disorder, anxiety, depression. And these skin rashes would pop up over my entire body off and on, just come and go really quickly. So again, when your body's full of stress chemicals, all these symptoms pop up. Mine are all gone. So when people come out of this, I'll use a chronic disease state. Again, there's multiple symptoms, physical and mental. And we actually think mental pain is actually the much bigger problem than the physical symptoms, even though neither one is great. But when you're stuck with all these different symptoms, they're miserable. You're trapped. Mm-hmm. And they estimate that there's 2 research papers that show that the effect of chronic, I don't like the word pain anymore because there's so many different symptoms included. So I use the word chronic distress is the same effect on your quality of life as having terminal cancer, except it's worse. Because in cancer, you know the diagnosis, you know it's wrong. The prognosis, you know a prognosis, either good or bad, but either way, you know what's going on. Not knowing the problem, not knowing the solution, not seeing the way out is incredibly devastating to people's psyche. It's horrible.
Yeah. So how long on average do people need to be in the program before they can really start to feel better?
Everybody's different. So we call the term dynamic healing. And what we're doing, let me just go to the essence of the problem again. Yeah. So most people think that stress is a psychological construct. Is that a fair statement?
Yeah.
Okay. So it's not. So every living creature has to process the environment in a way to stay alive. Mm-hmm. So stress is actually your threats. Whether it's a bad boss, bad marriage, whether it's a physical illness, that's all stress. Positive stresses, new job, marriage, all these different things, moving to a new location, those are all stresses. So stress is just the input. So then what happens, you have your stresses or circumstances. I call it the input. Then you have your nervous system, which processes these signals from the environment. Then the output is your body's response. So if your brain is sensing these signals are okay, or you're handling the stresses all right, then you're in neutral, or what we call a state of safety. But if your brain is sensing danger, then you immediately go into a fight or flight response, which is adrenaline, cortisol, inflammatory proteins, your metabolism or fuel consumption goes up. So the essence of all chronic disease, both mental and physical, is sustained exposure to stress chemistry. And the essence of healing is teaching people how to regulate their physiology from threat to safety. So when I say the word physiology, I mean, how does the body function? So a car sitting by the side of the road has no symptoms. It's just sitting there. So it's when you turn the car on and see how it runs, that's the physiology of the car. So blood pressure, temperature, respiratory rate, muscle tension, all these things are regulated automatically. That's called physiology. So under sustained threat physiology, your body starts to break down, and it does. So it's been well documented that sustained stress causes early death. All these things I just mentioned, heart disease, cancer, et cetera, all happen under sustained stress. So it's the chronic stress that's the problem. And so stress is just a signal. The problem is the physiologic response or the stress response. It's the response to your stresses that actually cause the problem. Now, did I explain that pretty well? That's sort of a long answer.
No, it's good. It's good. In terms of audience, who do you find is best equipped to take the course?
Anybody.
Yeah.
Yeah, I mean, what's happened now is that we found out the mental pain is much bigger than the physical pain. And the reason for that is that you cannot treat physical symptoms without treating mental pain. Mm-hmm. The way I say that is that what happens that humans have a major problem called consciousness. So my cat has a stress response where her hair flies up, she screams, she yells, and she runs away. Humans do the same thing. We have a physical threat, we get out of there or solve the problem, and problem resolved. But the problem is that our thoughts, unpleasant thoughts, actually create the same effect on your brain as a physical threat. So unpleasant thoughts are a threat, suppressed negative thoughts are even more of a threat, and humans can't escape their thoughts. You cannot escape your thoughts. So every human being has an issue with sustained threat response. So the sensation generated by that physiology or that state of hyper alert is anxiety. Yeah. So anxiety is a physiological state. It is not a psychological diagnosis. Yeah. So the real kicker here is why we're having so much trouble with chronic disease is that we try to get rid of the word anxiety. This is we call it an activated threat response. And when you solve the problem, the response drops down. But if you're trapped, your body kicks in more of a stress response and you become angry. So anxiety and anger are the same thing, just a matter of degree. But the major problem is that this threat response processes about 40 million bits of information per second. 40 million. That's a lot. So the conscious brain processes 40 million versus 40. It's a 1,000,000-to-1 ratio. So you're not going to solve this survival response with rational means, number one. It's a complete mismatch. Second of all, if you didn't have anxiety, how long would you survive? Not at all. So anxiety is a gift. Anger is a gift. We don't view it that way. We feel badly about ourselves if we feel this way because it's about yourself. It's about survival. It feels bad. It's supposed to feel bad. So to try to counter that with rational means, it can't work and it doesn't work. So we have the sustained threat response. Hence, we have this massive epidemic of chronic disease. Essentially, every chronic disease, let's talk about mental health for a second, is driven by trying to avoid the survival sensations that humans cause anxiety. So it's the driving force. Anxiety is the driving force behind human behavior, avoiding that sensation, but also the same force that creates all these diseases. So I'll ask you a rhetorical question that you're not supposed to get the answer. You might. Okay, it's just a rhetorical question. Just want people to think about this. So did I explain it clearly enough that stress is not psychological?
It's still going to be hard for people to accept that, I think. But yes.
Okay, but think about it again. I taught your audience again. I mean, Stress is a threat,
Yeah.
where thoughts are also the same threat. What we find out what's even worse, what got me in trouble being a spine surgeon, is that suppressed unpleasant thoughts are even more of an effect on your physiology than expressed thoughts. So whether you think the thoughts or suppress them, you're in trouble either way. So I liken it to spinning a basketball on your finger, is that if you experience the thoughts, of course, they get worse. If you suppress them, the basketball spins even faster, then the brain memorizes them. So I call it phantom brain pain, but the brain memorizes everything. So we do know, for instance, chronic low back pain. Okay, so first of all, we know lack of sleep actually causes chronic back pain, period. It doesn't have to be an injury, just lack of sleep causes chronic back pain. And the problem is lack of sleep is actually inflammatory. So now you have back pain, and then they find out, well, in the pain center of the brain, there's a certain spot that correlates with back pain. After 6 to 12 months, that center shifts to the emotional center.
Huh.
So unpleasant thoughts are sensory input. Emotions are what you feel. In other words, emotions reflect the body's physiology.
Mm-hmm.
So again, your circumstances, your threats, your situation is stresses. Stress is what's coming into your brain, called the input. Your nervous system could be calm or hypervigilant, and your physiology could be either calm or activated. So we call it dynamic healing, is that in medicine right now, we're treating just the symptoms.
Mm-hmm.
And we really are not making patients feel safe. So we teach ways to help patients give their bodies cues of safety, which allows them to drop down the physiology. So going back to the question that you're not going to be able to answer, is that if anxiety is this total body response to stress,
Mm-hmm.
it's not subject to rational control, how do you lower anxiety? It's a trick question, by the way.
Yeah, I mean, it sounds like there's a lot of exercises that need to happen to create that muscle memory to then bring down, that response that many of us are just so used to going to right away.
Yeah, you basically did get the answer. Is what you're doing, you're simply lowering the stress chemicals.
Yeah.
That's it. So you can do it through breath work, through exercise, through better sleep, et cetera, et cetera. So all you're doing is trying to lower your stress chemistry.
Mm-hmm.
So remember, anxiety is a sensation generated by your stress chemistry. And then as you learn tools to actually lower it, why it solves a problem. So what happens, we call giving yourself cues of safety.
Mm-hmm.
So remember, the most damaging stress is the stress that you can't control.
Mm-hmm.
And so people say, well, do stress management. That's not the problem. If you can manage the stress, people manage it. But it's that stress that you can't control that's a big problem.
Yeah, no, I think a lot of us love being in control. And so, how are you able to manage through situations that you can't? So,
Can I coach you for a second?
of course.
So what you learn to do is you learn to give up the need for control. In other words, you're not going to control the survival response. So we talk about developing a working relationship with it. So the anxiety and anger do what it's supposed to do. They protect you. It doesn't feel good, but there's ways of processing it very quickly. So you drop it down. It occurs multiple times every day. It's a dynamic process. As you learn to regulate your body's chemistry, you spend most of the days not being in fight or flight.
Mm-hmm.
So people think, well, I'm going to get cured of anxiety. Well, guess what? Again, you want to stay alive. It's a gift. It's 1,000,000 times stronger than your conscious brain. So you learn to separate your identity from this survival reaction. You learn to develop a working relationship with it. And then what happens, your conscious brain is free to move the direction that it wants. If you're using life experiences and pleasure and things to distract yourself, it's a 1,000,000 to 1 ratio, or mind over matter is even worse. So it's a 1,000,000 to 1 ratio. It can't happen, and it doesn't happen. So talk therapy, for instance, actually reinforces the problem. Mm-hmm. So there's ways of training your brain to feel safe. So I'm all over psychology, but there's a new field coming out called somatic psychology that helps people feel safe. Mm-hmm. When you feel safe, your body chemistry comes back into action. So, so there's two parts to healing. One is actually learning how to process anger and anxiety, or let's talk about activated threat response. And again, it's a dynamic process. It occurs every day. And that's over there protecting you. It's a gift. And then your conscious brain, where the healing actually occurs as you move your brain into what you want to do, then you start stimulating neuroplasticity, and that's when people really heal.
Yeah.
So you can't heal unless you negate these circuits. Negating the circuits doesn't really cause a healing. You actually have to get your brain onto the solution, not focus on the problem.
Yeah.
So it's like learning a new language. You're not going to learn French by trying to fix your English. You've got it. So the survival language. So the default language in humans is survival, stress reaction. And so the language that you want is, I call it, an enjoyable life. So I have a little saying: to have an enjoyable life, you have to live an enjoyable life. You have to practice. So their linked skills are separate. So processing stress is one skill, learning joy is another skill, and they're linked. But you can't use pleasure to counteract the negative forces.
Mm-hmm. No, it's fantastic, and I wish that this was more widely used with teenagers.
Right.
Uh, how much-
So we're actually working with kids more and more often. Let me just give you one example of somebody I'm working with right now. I won't tell you her name or age even, but she's young. She's very successful in her business,
Mhm.
and she's just gotten crippled with anxiety, just flat out on her tail with it. And you say, how long does this take to work? So she's somebody within 2 weeks, all of a sudden, she has hope.
Mhm.
So we know actually having hope actually has been documented in research to be anti-inflammatory.
Yeah.
So since chronic pain is one of the diseases by chronic inflammation, by the way, when I talk about all these big diseases, chronic pain is one of those.
Yeah.
Because what happens when you're inflamed is that the speed of your nerve conduction doubles, your brain becomes inflamed. So just having hope has calmed it down dramatically just in 2 weeks. Now, a lot of people, I say 3 to 6 months on the average.
Mhm.
It's a learned skill set. And so I talk about you become a professional at learning to live your life. So most of our skills are survival skills. So we are not taught how to process anxiety and anger. We certainly are not taught how to nurture joy. Most everything we do is a survival reaction.
Yeah.
So it's a learned skill set. So I talk about becoming a professional at living your life.
I like that.
So as you become more competent living your life, you just simply spend less time in fight or flight.
So, how can people learn more about this, and how can they get started? And is there um, a way to kind of tiptoe into this and make sure that it feels like a good fit? And how do people find you and learn more?
So what happens is that I put a process together called the DOC journey, direct your own care journey. And so you can't go from anxiety to happiness in one step. That just can't happen. So there's 7 legs to it. So the first leg, we tell you some simple tools to actually get started, to start calming your nervous system right away. And one of them, as you well know, is called expressive writing. You simply write down your thoughts, tear them up instantly. And you can't control your thoughts, but you can separate from them. So that's always a starting point. The second thing is learn about the problem. You can't solve a problem unless you understand it. The third thing is called active meditation. We just put your mind on a different sensation for a few seconds. Do that all day long. The fourth thing is sleep is a big one. If you're not sleeping, none of this works, but of course it's all linked. Then the final one on that first leg is really interesting because it's very concrete, very simple to do. We actually talked about it today in our coaching group, is never discuss your pain. Because where's your attention?
Yeah.
So I'm going to say, Pam, you're in my office. I'm going to say, when you walk out of this door, you'll never discuss your pain ever again with anybody, especially your family. Now, friends, family, or colleagues, you're going to stop discussing your medical care, no complaining, no giving advice, no criticism, no gossip, because all that's doing, it just fires up your nervous system.
Yeah.
So if you're constantly complaining from a neuroplasticity standpoint, that's where your brain develops. So this is not psychological. You're changing the physiological structure of your brain. So people have a hard time, because what I did find out myself personally, I did this myself for 15 years, but patients in chronic pain, including mental, talk about their troubles all the time. Almost, and probably 60% of their waking hours is spent thinking about their pain, trying to solve their pain. But again, your problem's on the solution, your attention on the solution, on the problem, not the solution. So it's an easy concrete step. So you walk out of my office today, done.
No, I think that's really good. And, it's certainly things that I've heard before in terms of starting your day with gratitude, making sure that you're constantly staying in positive words, positive voice, encouraging, supporting. Yeah, no,
Right.
it's good.
But the other thing I want to tell the listeners, this is really critical. So this is not about David Hanscom. I don't have some magic formula. I'm just bringing the proven neuroscience into the real world, and somehow medicine is overlooking it completely. So these are proven medical treatments. My contribution is to arrange them in a way that people can access them. But the healing process actually starts with your skepticism,
Mm.
because you have to connect with what is. So what doesn't work is positive thinking, because you're covering up negative thinking. And so people think, well, if I just generate enough belief in David Hanscom, I'm going to heal. Or I believe enough belief in the doc journey, I'm going to heal. It's the opposite.
You got to believe in yourself.
Right. So you want to connect with your healing capacity, which means you connect with yourself, which includes the negativity. So it's actually based on, I actually encourage people, don't believe me, just suspend your disbelief enough to engage and watch.
Mm-hmm.
And I can't tell you, hundreds and hundreds of patients have gone through this. So again, the other resource we have called the Doc Journey app, which again is very interactive, very entertaining and enjoyable, but also educational. And so then I did write the book Back in Control, a surgeon's roadmap out of chronic pain. I just picked it up a couple of days ago and reread parts of my book and go, oh, this isn't bad. It's actually, so it's, but see, what it doesn't reflect the latest neuroscience, but it's a great foundation about what the problem is. So the problem is if people are trapped and angry, which you are in chronic pain, your brain goes from the thinking centers to the survival centers. So the problem actually blocks treatment. You can't think clearly, right? So one of the biggest problems we have is that people don't want to give up their pain because they can't hear me. So that's one of our challenges. So people that are willing to engage and stick with it, again, it's like learning how to play the piano or play an athletic sport. Mm-hmm. You're not going to learn how to play golf by reading a golf book. You're not going to learn how to play the piano by just looking at the piano and reading a book. So these are skills you practice, again, to become a professional at living your skills, practicing your life skills. And as you just be competent at everything, processing stress, living your life, doing what you want to do, your brain changes. And people really do heal. They really drop out of their pain completely. I had one patient, 55 years of chronic pain. She's been fine for 6 years now. Another gentleman, 28 surgeries in 20 years. He's never felt better in his life. Me personally, I was in chronic pain for 15 years. I had given up completely. And so what's fun about this process, when you don't have to fight the pain of your brain anymore, people thrive at a level they never knew was possible. So again, quitting my practice was a big deal. That was not a small step. But people heal so completely. It's incredibly inspiring. Plus, it's hard for me to watch people being so badly damaged by medicine right now. So yeah, it's been an incredibly rewarding project. That's why I have so much passion behind it, as you know. And then you're gonna be on my podcast next week, but I mean, you have the same passion. I mean, you watched some serious healing take place. You see it happen all the time. Yeah. It's pretty inspiring, right?
Well, yeah, especially if you can combine the worlds of reducing inflammation from what you put in your body and also how you're thinking about, your situation around you in your life. So now it's super powerful.
Right. So it's very powerful. It's very consistent. It's not so hard. Yeah. And what I didn't realize as a surgeon, I mean, we're very focused on structure, where 90% of your symptoms are based on physiology. So things like mindfulness, meditation, and exercise and sleep are going, yeah, whatever. That's all these things you're doing are actually anti-inflammatory. Mm-hmm. So we know, for instance, if you are eating a high sugar diet, that inflames the heck out of everything. And people that have healed, including myself, I mean, surgeons got to be the worst people on this planet for diet. I mean, one example, one of my fellows sat down for lunch with me one day, and I don't eat very well, but he sat down with 3 bags of popcorn and 2 Pepsis. Okay, so maybe you hold a record for a bad diet, but anyway, surgeons don't eat well because we're just so busy all the time. But when you're eating constantly processed foods, it just inflames the heck out of your liver. The what happens is the fat goes to your abdomen, and as you know, it's that core abdominal fat that's like a little furnace in there, throwing off inflammatory cytokines. And so, yeah, just an anti-inflammatory diet is really critical. But let me say one more thing. So solving chronic pain is complex. Everybody has a different set of circumstances. So one interaction on its own never works. In other words, an anti-inflammatory diet is not going to work. Now, can it add on to the other things you're doing? Yes. So if you're doing better sleep, you're exercising, your diet's good, it's that additive effect of all those interventions, that's what causes the body to heal. Conversely, though, if you're eating a horrible diet and not sleeping, nothing else really matters. So it's a combination of things that's really individual. But the bottom line, the person has to take control of his or her care, because who else is going to solve the problem? It's not your doctor. Now, I can spend 8 hours a day with you, talk to you, listen to you. You're not going to get better. In fact, you're going to get worse. So the key issue here is the patient takes control. It's not very hard to do. The patients that have healed have pointed out this is disturbingly simple. And I'm not that happy I lost 15 years of my life. I did. 15 years in chronic pain is a long time. I'm not that happy about it, especially when I know that it was really preventable and certainly could have been cut a lot shorter than it was. So yeah, it's very exciting for me to at least give it back. And that's how I learned it, was my hard way. I don't want to throw my colleagues under the bus because I was one of those guys. I did surgeries. I had no idea about inflammation. I didn't really respect the body's physiology. We just weren't trained that way. Mm-hmm. So anyway, it's become by far and away the most rewarding phase of my career.
No, that's super. How do people find more about you and how to go through the DOC journey?
Right. So basically, it's called the DOC. Okay, so my book is Back in Control. My website is backincontrol.com. So on that website, you can see a link to the Doc Journey course. You can see a link to the Doc Journey app. That's probably the easiest entry point, is to get onto the backincontrol.com website and then take it from there. So again, with the Doc Journey course, I recommend maybe 15 to 20 minutes a day at the most. Mm-hmm. I mean, if you read a whole piano book, you're not going to learn the piano. So if people jump through the course quickly, they get very frustrated. So it's just 15, 20 minutes a day, just day after day after day. Repetition's key to retrain your brain. And so then the app, same thing, just it's audible, it's interesting and entertaining. And then as part of the Doc Journey course, I actually offer group coaching sessions twice a week on Tuesdays and Thursdays. It's about 25 to 35 people per session, and we have a great time. So the sense of community and structure really helps calm down the nervous system also.
Super. Well, thank you so much, Doctor. Really appreciate your time.
Yeah, thank you.
That's it for this episode of Encouraging Wellness. We hope this serves as an eye-opener to you on new ways to approach your health and wellness. By learning both unique and the best alternative wellness and healing methods, you can live your best life. Listen to more of our episodes at www.hello.health. Be sure to subscribe to the show and leave a rating. Together, let us work towards unlocking you and your family's best self. Thank you for listening. See you on the next one.